going to perform the assessment of the heart and the blood vessels, or the cardiovascular assessment. So the first procedure is we have to assemble our equipment and supplies that are going to be needed in the procedure. So next is, of course, the procedure is the assessment of. So we have to introduce ourselves to the client. Please, I am Richie Mae, Pintor, your student nurse for today. Then identify the name of the patient. Miss, what is your name?
Pintor Olivera.
Okay. And then, so we have to explain to the client why we are going to do this procedure, which is the heart and the blood vessel assessment. So explain to the client what you are going to do. So Miss, so I'm going to assess your heart and your blood vessels to detect determine the problems or any in your arteries or your veins. So and then we have to wash hands or check for appropriate infection control, such as using alcohol. So next we have to determine the client history of the following. So Miss, any incidents of heart disease, history, hypertension, stroke, okay, no, so body fever, or heart failure, no, none again, okay. So you are negative of heart disease. So presence of defect hearts, none. So after determining the client history, we're going to proceed to the measure of the blood pressure. The measure of the blood pressure is to detect the action or potential to the static hypotension and therefore the risk of pulse. So should the client or the sitting or standing or lying position and the pulse rate of the client line after 5 minutes and the pulse for 1 minute and after. So, and then we have to go or get the blood pressure of our patient. So we have to lie for 5 minutes with us. And now let's start. I'm going to take your BP while you are sitting down. Sit down. Your BP is 90/70, then we have to wait for 5 minutes again. Then after 5 minutes, we have to check your BP while you are standing. So ma'am, this time you have to stand up. So and then start again. So this is supposedly after 5 minutes. So your BP is 90/60. So, and then this time, we have to lay down now. Can you please lay down? So while laying down, after 5 minutes again, we have to get our BP. So 100/60. check your pulse. So, for 1 minute. So pulse is 60. So we have to wait again 5 minutes. This time we have to sit down muna. After 5 minutes, another 1 minute pause while sitting down. So after 1 minute, it is 60 again. So this time, after 5 minutes again, we have to check the pulse by a standing position. So ma'am, can we stand out now? So supposedly it is 5 minutes, and I will check this pulse. So 65. So sit down naman. So after getting the blood pressure, we have to proceed the exercise tolerance. So to measure this, activity tolerance is to evaluate either or observing the client from sitting to a standing position, or fingers from, according to what I observed ago, from sitting, lying down, and standing. So for the pros, we have then to determine the by palpating the arterial pros, education like parotid, radial, popliteal, posterolateral, and for the strength of symmetry. So for the carotid, gentry are one side effect to stimulating brachial, the existing to causing symptoms or stroke. So I'm going to get your pulse now, ma'am. So this is the carotid. So for the arteries, so for arteries and veins, we have to auscultate if the carotid or the arteries. So for the clinical tip, use the stethoscope to listen to this, like this. And then just lay down naman. Just lay down naman. to evaluate arterial or sufficiency or extremities. So we have to elevate the legs above the heart. So ma'am, can we elevate these? And straight. Pwede na sama straight. Please. Pwede mo siya ma'am straight. And like that. So, and then inspect and palpate while the client is standing. Yes. Please stand up now. And palpate of the expansion of the structure, auscultate. So, sir, after 1 full minute, so it is, your heart is 64. And this time we have to thank the client for cooperation and to aftercare the patient or assess patient in a comfortable position if necessary. So, and then we have to do our hand hygiene and or other appropriate hygiene. And then lastly, we have to document the result to the patient's record. Ayan. Please lay down. That's all. So, ma'am, once again, thank you so much for cooperating. Once again, I am Richie Mae, Pintor, your student nurse for today. I hope you learned something and enjoy this video.